Well, welcome back. In today's For Your Health, a new study reveals very few heart patients follow their doctor's orders when it comes to taking medications to help prevent heart attacks or stroke. Researchers tracked more than 5,000 adults with cardiovascular disease who had been prescribed the cholesterol-lowering drugs. Only 6% took them as directed, even though these medications reduce the risk of heart attack and stroke by almost half. Many patients said they were concerned about the potential side effects, and others incorrectly believed taking these medications were not important. To take aspirin or not to take aspirin, that's the question many people have when it comes to their heart health. Meredith Wood takes on this age-old question in today's Health Minute.
An aspirin a day has long been held as sage advice when it comes to preventing or staving off a heart attack or stroke. But according to new guidelines by the American College of Cardiology and the American Heart Association, the benefits may not outweigh the risks for older adults without a history of heart disease. For those adults, the study's author says a healthy lifestyle, coupled with getting blood pressure and cholesterol under control, are the best preventatives. A daily low-dose aspirin can increase the risk of internal bleeding and early death. One of the study's co-chairs says daily aspirin regimens can benefit older adults with a history of heart disease who have trouble lowering their cholesterol. As always, there isn't a one-size-fits-all rule. Every patient should work with their doctor to determine the right prevention plan for them. For today's Health Minute, I'm Meredith Wood.
Well, more children and young adults are going to the emergency room for psychiatric care. Researchers from Johns Hopkins University looked at ER visits between 2011 and 2015. Well, they found psychiatric-related visits rose 28% in people under 24. The largest increases were among teens, young adults, and minorities. And although most of these visits were long, very few patients saw a mental health specialist while in the ER. Parents don't need to wait to give their babies peanuts or other allergic foods. The American Academy of Pediatrics says introducing these foods as early as 6 months can actually help prevent allergies. However, high-risk infants who have severe eczema or an egg allergy may need to be introduced to peanuts under a doctor's supervision. The research on people who eat nuts shows the snack may be helpful in controlling weight, but some are better for you than others. Haley Hernandez reports.
It's true that nuts are high in calories, but in several studies, eating a handful a day was associated with weight control. Dietitian Erin Gussler insists it's a good snack, but keep it to one handful.
Now, not the claw where it's overflowing, right, but a handful.
Her favorite nuts for snacks are Brazil nuts for the disease-fighting function. These have more selenium than any other nut, a mineral important for thyroid function and reproduction.
High doses of selenium can actually cause toxicity, so I usually recommend, if you are going to do Brazil nuts, 3 to 6 a day.
Gussler says most nuts are great to get your micronutrients. In addition to protein, fiber, and healthy fats, nuts also supply a decent amount of magnesium, potassium, and vitamin E. Almonds are the nut's highest in fiber. Gussler also loves cashews, which can help with eye health. Walnuts are a good source of omega-3. Plus, according to Consumer Reports, pistachios contain more potassium than half a banana. But Gussler says she dislikes clients eating peanuts.
Potential to be a higher mold nut.
Higher mold?
So the potential to have a little bit more mold around that nut, and then potentially you're eating some of that.
I didn't know nuts had mold. All right. Well, drinking sugary drinks may lead to an early death. Researchers at Harvard University examined data from 2 studies involving over 118,000 people. Those who frequently drank sodas or sports drinks were more likely to die from heart disease or cancer to a lesser extent. Substituting a daily soda with an artificially sweetened drink slightly lowered that risk. However, women who drank at least 4 diet sodas a day had a higher risk of suffering an early death. If you're thirsty, experts say you're better off drinking a glass of just plain old water. And I agree with that. I'm not a fan of sodas, so give me the water all day long.